1 second.
Don't worry. You just do whatever you have to
It's
do.
wanting me to, I don't know if anyone else is, this is a new computer that we just got, is wanting me to like quit out and everything and like leave the meeting and restart my Zoom.
Oh,
If Joe or Kime wants to try it, I can do that. But if you guys want to try it and see if it's not asking you to do that.
okay.
You can try. Yeah. Suad, if you want to try making me co-host, I can try. I can't promise that. I don't think I've ever shared a screen before, so I don't know. We'll see.
All right. I got me a lot.
We'll figure it out. It'll work out no matter what, but
Don't worry, it will work out. It will work out. We're gonna make it work. What's up? Why are you looking at me like that? Sorry.
that's
You got it.
okay. But now I have to like make this look better. Hang on.
Like the presentation mode. Yeah.
I'm like, yeah.
Wait a minute. Wait a minute. It's going.
Okay.
Oh, wait. Are we talking about second trimester today?
Oh, that's what we were told.
Oh, second trimester? I guess. But
Have you guys done it already?
Oh,
Zainab, do we done a second trimester already? We did first trimester, second. I think it was second trimester we were supposed to do. Let me see my note. Okay, we can talk about second trimester. I thought we were going to talk about miscarriage, but I think we might have talked about miscarriage. I think we did talk about miscarriage.
Yeah. I think I'm pretty sure that I'm pretty sure that the group already had a miscarriage presentation.
So second trimester. Okay, sure. Let's do second trimester. So
sorry for the surprise.
oh, no. This is good. Let me go post my Facebook Live, see if anybody has questions, and then we can just start it.
And did you guys talk about first trimester last month?
We talked about first trimester, then we talked about loss. And I think this is second trimester.
gotcha. That makes sense. And let us know when you're ready.
All right. Awesome.
All right.
I think we are in. Great.
And do you like to do any sort of initial intro, or should we just begin?
Yes, we can do introduction. So welcome everybody this beautiful Saturday afternoon. Today is December. When is December? It's December 4th to Mommy's Corner. I am Suad, your host. And today we have 3 doctors who are going to be doing their own introductions because they're new. I only know Molly so far. And our topic is second trimester in pregnancy. So doctors, please feel free to introduce yourselves.
All right. Well, thank you. We're very pleased to be here. I'm Dr. Kime McClintock, and I'm a first year resident at the Swedish Family Medicine residency here in Seattle.
Thank you. Welcome, doctor.
And
I'm Dr. Joanna Posada. It's so nice to be here with you all virtually. I'm one of the second-year family medicine residents, also here in Seattle. I'm from San Diego originally, and I'm excited to be here.
Awesome. Thank you, Dr. Joanna. Thank you, and welcome. And last but least, Molly.
Hi, everybody. My name is Dr. Molly Thayer. I'm also a second-year resident here in Seattle, coming over from the East Coast. I grew up in Boston.
Thank you, Dr. Thayer. Thank you. Thanks for thank you and welcome you all. And I can't believe I noticed all of you, none of you are from Seattle. Some of you from East Coast, some of you are from West Coast, but we're all here in Seattle in this raining day. And thank you for having this wonderful evening with us, sharing this wonderful evening with us. And we can start. So those of you who are in Facebook Live, if you have any questions, you can put it in the chat. And those of us who are here, if you have any question why we are, recording and we are giving the presentations, you can raise your hands or put your question on the chat. And also I will be interpreting as we go along. Hopefully it will go smooth and we can start.
Wonderful. Well, thank you for that beautiful introduction and welcome everyone. We're very pleased to be here. Like was already said, we'll be talking about the second trimester of pregnancy today. And I also want to give credit to our colleagues, Drs. Jasmine Abraham and Amelia Gallagher for all the work that they did in creating this presentation. So yeah, as a brief intro on if we can, next slide, please.
Sorry.
No, you're good.
There we go.
There we go. Awesome. So just as a brief agenda, so and introduction, in terms of in pregnancy, it breaks down into the first, second, and third trimester. Today we'll talk about second trimester pregnancy, and we think of weeks 13 through 28 as sort of counting in that second trimester range. We'll be going over what's happening in the pregnancy, both in the pregnant person's body as well as to the fetus or baby, what to expect about your body changes, and then what you can expect from your doctor and what kind of questions you can be bringing to them and what kind of advice they might be giving you. And so, yeah.
Okay, I can translate. Abayo, and waxay tiraahday maanta waxaan ka hadlaynaa second trimester pregnancy-ga macnaha waqtiga 3 bilood waa mugtahay 3 bilood ugu horeyso ma ahan 3 bilood oo ku xigta laga hadlayaa. Waxay ka bilaabanaysaa in 13 week oo 13 week ilaa iyo 28 week. Wixii qofka maxaa la dhahaa gabadha korkeeda ku dhici lahaa iyo wixii soo socdo korkeeda ku dhici lahaa iyo dhaqaatiirta waxay dhihi lahaayeen bilahaasayto ee dhexda ku jirto dhexda ku jiraan waxaa la dhahaa second trimester. Go ahead.
Okay, so the second trimester is a really exciting time because so much growth is happening with your baby. The first trimester, you might not even see that many physical changes in yourself. Your belly might not be that big, but in the second trimester is really where you can start to really realize, oh my gosh, I'm growing a baby. So at this point, the baby is actually like really quite developed. It's the baby has grown all of its organs, including heart, kidneys, eyes, ears, all of the internal organs. And really the sort of priority for the second trimester is growth of baby. So this is also the stage where starting usually around 20 weeks, when you come into your clinic visits with us at the doctor, we start measuring baby from the outside. Because we've already kind of confirmed that baby is like healthy and developing normally with your first trimester ultrasound. And then at 20 weeks, we start measuring with the little tape measurer, making sure that the size of your belly corresponds to how big we expect baby to be at this point. And you're kind of just cruising from there, baby's just doing their thing, growing inside of you. It's very exciting.
And second trimester also waxaa dhacayo ilmihii way weynaanayaan raali ahaada inkula la horteeda socoto cunuga way weynaanaya calooshaada waxa weeyaan 20 sitmaan markuu cunuga jiro waxaa dhacayso in aad waqtigan ay la mid tahay waqtigii dhakhtarka aad imaanaysay la fiirinayo cunuga koritaanka hooyada caloosheeda dhexdeeda waxay ku fiirinayaan measurement wax la dhahayo markaa isbitaalka tagto waqtigan waxaad dareemaysaa calooshaada inay soo weynaanayso iyo waxyaalo badan oo jirkaaga oo isbedel ka dhici doono ayaad dareemaysaa xilligan aad ku jirto waa xilligii la dhahayay second trimester. Keep going.
Okay, so it's a little graphic here, just sort of talking about what's happening to your body and your baby's body in the second trimester. So towards the end of the second trimester, the average baby is about 13 to 16 inches long. So you can think about like a foot, like if you're measuring something, it's sort of right around there, a little bit bigger, and weighs about 2 to 3 pounds. And during this time, they're developing things like reflexes, so like sucking on their thumb, and then they're having things grow, just like the organs inside of their body, also the things that we think of on the outside, so like fingernails, hair, and all those things start to grow and form as well.
waqtigaanayto cunuga wuxuu jiraa adi halahan oo kale la eg yahay sidii markino wax taas weyn ma ahan 2 ilaa 3 pound ayuu jiraa macnaa culayska cunuga waxay nuugayaan maxay la dhahaa fartooda nuugayaan timahooda waa soo baxeen maxaa la dhahaa farahooda waa la sameeyey adi korintooda ilaahay subxaanahu wa tacaala wuu u dhameeyey kulli futurekooda macnaa inay qof bini aadan ahaan ay yihiin kulli waa loo wada dhameeyey waqtigaanayto waa 20 week markay ku jiraan waaye marka waxooda dhan way u dhamaysan yihiin waa dareemaysaa adi xataa dhaqdhaqaaqooda.
One of the other things I'll add to this slide before we move on is that in addition to your baby growing in size, the amount of fluid around your baby is also increasing. And that's a really important part too of the second trimester and of your baby's growth overall. And some people don't always know this, but the fluid there that baby is growing in is actually baby's urine. And one of the ways that we're able to track to make sure that the baby's organs are developing normally is specifically the kidneys, which is what forms urine, is whether or not there's an adequate amount of fluid around baby that allows all of baby's limbs and body to grow adequately in your uterus. And so we sometimes will measure the amount of fluid in your baby during the in your uterus during the second trimester as well.
Well, and then to even go off of that too a little bit, then the lungs develop through swallowing that urine, which sounds silly, but it's how it works. And so sometimes if you have too much fluid, another reason why we measure it is that can be a sign of lung development or issues with the lung. So it's some interesting physiology.
waqtigan also waxaan fiirinaa ama aan ilaalinaa cunuga ilmaha koritaankooda oo ka mid ah lungskooda maxaa la dhahaa lung maxaa lagu dhahaa af Soomaali gabdho ee qabta sambabada koritaankooda iyo keliyaha ilmaha waqtigaanayto way kaadiyaan kaadi badan ay kaadiyaan waxaad dareemaysaa calooshaada inay macnaa biyo badan ayuu cunug ku dhex jiraa mogta ilaahay subxaana wa tacaala wuxuu ku abuuray ilmaha inay biyo badan ebada dhexdeeda ay ku dhex jirto biyahaasayto cunuga ku dhex kaadinayo laakiin wax problem ee kama soo gaarayo ayay leeyihiin waxay also fiiriyaan waqtigaanayto keliyaha ilmaha siday u shaqaynayaan keliyada ilmaha siday u shaqaynayaan iyo sambabada ilmaha siday u shaqaynayaan ayay si fiican u eegaan waqtigan waa waqtigii ay kala ogaanayaan ilmaha maxaa la dhahaa jirkooda inta dhexda ku jirto sidii sambabada keliyaha iyo xubnaha kale oo ka mid ah jirkooda shaqayntooda. Isn't it the time that they check on ultrasound? Or is the 24th week?
We'll get to that. This is around the time that we do one of the important ultrasounds.
Okay.
Yeah.
So we've heard a little bit about all of babies' organs developing, and that includes their nervous system and their ability to move their body and move the muscles that are developing. So typically around 20 weeks, but sort of in that mid second trimester time is when you might first begin to feel baby start to kick and or just move around, not necessarily kicking, but moving their limbs and sort of shifting. Some people describe it as like a flutter when they're first starting to notice that feeling. So yeah, it's not always as obvious as I think sometimes we visualize, like someone who's very pregnant and you see like a whole limb, which it can be, but sometimes it's just as subtle as a little flutter. But it's a pretty exciting, just to be able to have some of that like feedback, and know that your baby's moving around and developing. As Dr. Joanna was saying, your belly is starting to grow. You also might start to notice some changes in your skin, like feeling pretty tight, especially as your baby and the fluid around baby is growing. The skin on your belly is going to get tight and it might be itchy, which is something that's important to notice, just because that itchiness can also be a sign of something that's like cholecystasis of pregnancy, which we can talk about if there's questions, but we'll table that for now. But so that's just something to share with your doctor. If you start to notice it and it starts to get bad, it can be an important thing to share. Other things that are changing. So all throughout pregnancy, there's a lot of hormonal changes. So some things that you might not expect, or that you could start to have some congestion, maybe like bleeding gums, or in your mouth, like in your mucosal membranes, you might have some bleeding and some irritation. And that's just due to the increased blood flow that you're getting in those parts of your body. Some pregnant people notice that they do start to have issues with constipation and hemorrhoids, and maybe even some skin color changes. And the skin color changes, typically, not always, but usually can resolve after pregnancy. And then the constipation and hemorrhoids, there are things that can be done with that. I think getting a really adequate amount of fluid intake and drinking plenty of water can help with the constipation. Making sure that you're eating enough fiber becomes really important. And then for hemorrhoids, things like sitz baths are something that we often tell folks to try if they're experiencing hemorrhoids. Yeah.
In second trimester also waxaa dhacayo xilliga ku jirtid 20-ka maxay yiraahdaan sitimaan, cunuga inuu weynaanayo, cunuga wuxuu bilaabayaa dhaqdhaqaaq, maxaa la dhahaa calooshaada xoogaa inay soo weynaanayso. Markaa dharka xirato waxaad dareemaysaa inuu dharka qaarkood maxay yiraahdaan kugu dhegayaan dhinaca calooshaadii oo kale, sida gurguradaha markaad xirato kor aad ka xirato inay kugu dhegayso kala dareemaysaa. Also waxaad dareemaysaa calooshaada inay maxaa la dhahaa cuncun ay leedahay meelaha markino oo gurgurada meesha laga xirto oo kaleeto cuncun yaraad dareemaysaa korkeeda. Waxaad also dareemaysaa hormone change-gaaga dareemaysaa, hormonkaaga ayaa isbedelaya, of course uur baad leedahay, naasahaaga way isbedelayaan. Also hooyada waxay isku arki doontaa ama laga yaabaa inay isku aragto xoogaa inaa duri uu ku jiro kaleete, ama waxaa laga yaabaa markay musqusha ku jirto ay ilkaha cadaysanayso in ay ma arkinoo dareento ilkaheeda markay cadaynayso inay dhiig ka soo baxaan kor ama hoos, meelaha maxay yiraahdaan la cadaynayo kale. Waxaasoo kale waxay la socdaan uurka iyo maxay yiraahdaan hormoonkeedii la socdaan, iyo saxaradoo ku dhegto ayaa la arkayaa marmarka qaarkood, ama inay ku dhacdo hemorrhoids. Waxaa laga wadaa hemorrhoid maxaa la dhahaa gabdha Soomaaliya soo xasuusiya? Babaasir. Hemorrhoid saxarada kugu dhegto, saxarada markay kugu adkaato aad iyo aad kugu adkaato waxay isku bedeshaa babaasirka. Also waxaa isbedelo korkaaga, kasoo qaad dabcan hadda gabadha aan sawirkeeda oo kaleeto halkaan intaad ku aragto marmarka qaarkood waxaa arkaysaa gabdhaha halkaan kama madoowaado, dhabanada kama madoowaadaan ama qoorta kama madoowaataad arkaysaa, taasoo oo maxay yiraahdaan keento uurka, especially markay gabadha ku jirto xilliga oo second trimester-ka ah. Waxyaalahaanito aan hadda kasoo sheegnay, especially maxay dhahaan constipation-ka, macnaha saxarada ku dhegtay, waa iska ilaalin kartaa, waxaa isaga ilaalin kartaa adoo biyo badan cabay iyo adigoo maxaa la dhahaa cunto fiican oo jilicsan cunay, nutrition-kaaga ka shaqeeyey, oo aadan cunin cunto adag sidii maxaa la dhahaa bariiska ama baastada, laakiin waan ka sheekeyn doonaa nutrition-ka also gabadha uurka loogu talagalay oo cunayso, insha Allah. Go ahead.
Okay, so kind of continuing off of what Dr. McClintock was talking about, just a lot of different changes are happening with your body, and it's important to tell your doctor about them because Many of them are totally normal, but like Dr. McClintock was saying, some of them can be an indication of something that could be wrong or something that could be a problem later in the pregnancy. So your doctor is definitely going to want to know about any of these changes that you're having. So one thing that can happen that's totally normal in the second trimester, most of the time, is a lot of increased vaginal discharge. So that's just the kind of the discharge or like the sort of mucus that comes out naturally during from our vaginas, but it can be increased in quantity during the second trimester. Your doctor's definitely going to want to know if that discharge has a really different smell than it normally does, or is a really different color, like yellow or green, or like if it's like white but not clear, or especially if it's causing like itchiness or pain in your vulva, because that can be a sign of an infection that would be important to treat. Something that I feel like a lot of people don't necessarily know about during the second trimester, especially if it's the first time that they've been pregnant, is something called round ligament pain, or this like lower abdominal pain that's written here. So if you look in the diagram of the uterus right here in the upper right, I guess, so your uterus is this big organ that is attached to your abdominal wall by these ligaments, which are basically like sort of like stretchy strings of muscle that like secure the uterus in place. So it's not just floating around your belly, like free floating. And as you can see, I mean, your uterus is growing. Those round ligaments is what they're called. They're stretching a lot, and that can cause actually a lot of discomfort in the lower area of your belly. Usually it's like worse on one side or another, but often it can be just on both sides. And that pain is something that people notice is much worse or better in certain positions. And it's important to talk to your doctor about that, because we're always going to be asking you during pregnancy, you know, are you having any contractions? Because we want to know whether or not you're having signs of preterm labor or like having your baby too early. And sometimes people will say like, well, yeah, I'm having all this like pain down there. And then we have to kind of figure out, okay, are these contractions or is this round ligament pain? Because the round ligament pain is totally normal during the second trimester, but contractions would not be normal. So your doctor will kind of ask you some questions and ask you to describe the pain a little bit more to decide what's going on. And again, usually the round ligament pain is like off to the side. Contraction pain would be usually kind of in the center of your lower abdomen. And their doctor should also be able to give you some exercises and some stretches that can be really, really helpful with round ligament pain, in addition to things like heating pads and just like over-the-counter medicines that are safe in pregnancy, like Tylenol. As throughout pregnancy, your appetite is going to be increasing, and you will likely be gaining weight during the second trimester as your baby gains weight. And your doctor should also throughout pregnancy be giving you kind of healthy guidelines for weight gain, because we do often expect people to gain weight in pregnancy. But that recommendation can change a little bit if you're starting pregnancy from already a higher baseline weight. It might be recommended that you gain less weight than like the typically recommended 25 to 35 pounds. Last thing on this slide is about blood pressure checks, which is something that is always important when you go to the doctor, but becomes really, really important during the second trimester. Because high blood pressure can be a sign of a condition called Pre-Eclampsia, which is a really serious and dangerous condition in pregnancy. And it basically means that we don't actually know exactly what causes preeclampsia, but we think that it is basically vasospasm of the blood vessels in your body. And that just means like tightening of your blood vessels that can cause damage to your organs. It's related to high blood pressure, and in its worst case scenario, it can cause seizures. And so we're going to be checking your blood pressure like very, very vigilantly throughout pregnancy, and also asking you about symptoms that can be signs of preeclampsia. And those include headaches that aren't getting better with Tylenol, any new shortness of breath or chest pain that could mean your heart is being affected, or any pain under your right side of your ribs, which is where your liver is, and your liver can also be affected by preeclampsia. So that was a lot of information. I'll let Suad kind of start interpreting some of that, and we can definitely answer more questions about any of that later.
I told him I'm not going to do word by word. I was checking some of the words, rechecking some of the words, see if they change in my Somali dictionary, but they haven't. So I don't know how I'm going to interpret it, but I'll try my best. So second trimester also waxaa dhacayo in aad isku aragto waxyaalo qoyaan ah oo kasoo baxaya hoos. Ma dhihi kara ereyga kaleete because haddaan dhaho ma garanayo si loo dhaho waa garanaa laakiin ma jecli inaan dhaho. oo kasoo baxaya hoos maxay yiraahdaan waxaasaytu waa normal laakiin hadday ay wax badan ay yihiin aad dareento dhakhtarkaaga waa inaad ula socodsiisaa laakiin waxaasaytu waxaa la dhahaa discharge waa wax normal ah markay ay gabadha uur leedahay especially second trimester iyo wixii ka dambeeyo teeda kaleete lower abdominal pain waxaa la dhahaa hoos maxaa la dhahaa dhabarkoo kaleete xanuun ah because cunugia koraayo mogtahay wuu weynaanaya marka gabadha waxay dareemaysaa culeys badan calooshana waxa weeyaan way weynaanaysaa marka waxaad dareemaysaa inay kala jiidmayso kaleete sidii bomb maxay yiraahdaan sidii wax la kala jiidayo kale marka waxaasteetu waa normal teeda kaleete seedaha waxaad dareemaysaa inay ku xanuunayaan ood u malaynayso inuu la kala jiidayo sidii markino oo wax la qabto la kala sii fajinayo kaleete taasna waa normal xanuun yaraa jiro seedaha ku xanuunayaan ama dhabarka hoos ay ku xanuunayso ama caloosha hoos markino ay ku xanuunayso haddii xanuunkaasayto bato waxa inaad la socodsiisaa laga rabaa dhakhtarkaaga inuu bato lama rabo laakiin inuu oo macnaa oo joogto ina lama rabo waa wax iska wax dhacaya weeye gabadha markay uurka leedahay laakiin inuu bato lama rabo waa inay xogaayar u ahaadaa gabdhaha markay uurka leeyihiin second trimester markaa gasho marka hore waxaa laga yaabaa first trimester inaad mantag badan aad samayso ama walaci aad ku jirtaa marka hadda walaci waa kasoo tagtay waxaad gashay bilihii ku xigay oo walaca waa 3 bilood ku xigtay because waxaad martay 3 biloodii hor tan hadda waxaa ku jirtaa 3 bilood oo dhexda ku jirtay tii saddexaadna way kuu dhiman tahay oo 3 bilood ugu dambeysay marka kii dhexda ku jirtaa second trimesterka marka waxaad dareemaysaa in gaajo badan ay ku qabato ood rabtid inaad wax badan aad cunto marka waad cuni kartaa cunto badan waa cuni kartaa laakiin cuntadaada waa inay ahaataa cunto healthy ah oo caafimaad leh wax walba dam ha iska siinin teeda kaleete haddaadan marka hore qof caata aad ahayd waxaa lagaa rabaa inaad at least 30 ilaa iyo 35 kilo inaad maxaa la dhahaa oo kusoo koro oo hilib ah laakiin haddaa marka horeba qof buuran aad ahayd waa inaad la socotaa in hilibkaaga because hilib badan inuu ku koro lama rabo haddii ugu badato waxaa la rabaa inuu ku koro 20 iyo 25 inta u dhaxayso kilo oo maxay yiraahdaan hilib ah la soco dhakhtarkaaga in la hadal waxaa kaloo jirtaa arrin la dhahayo high blood pressure waa dhiikar waa cudur oo dilaa ah oo aan la dareemeynin oo aan la arkaynin cudurkaanito oo ugu badan gabdhaha markay uurka qaadaan an nafsadeeda ahaan sucaad way igu dhacday 3 mar ilmaha aan dhalay dhiikar waa qabaa way igu dhacdaa laakiin markaan dhalay ilmaha way iga tagtaa especially dadka madowga dadkeena madowga ugu badan cudurkaanito wax la arkayo ma ahan laakiin wax la dareemayo wuu yahay waa inaad dhakhtarka important weeye inaad visitkaaga dhakhtarka check-upkaaga markaa leedahay ina aad tagto cudurkan waxa kaliya lagu dareemayo waxa weeye ugu kamid ah madax xanuun badan aad isku arkaysaa iyo qanjiraha ma arkino inay ku xanuunaan surkana inuu xogaayar aad ku xanuunayo ayaa dareemaysaa iyo neeftaada oo kor u soo qaadmayso oo neef badan aad neefsanayso maxaa la dhahaa pain under the right rib iyo waxa ku xanuunayo lafta ma arkino lafta hoosteeda gacantaanito the right rib bidixda miyaa la midigtaha hoosteeda ayaa ku xanuunayso hoosteeda marka hadduu xanuun badan aad ka dareento meeshaasayto feerta hoosteeda waa inaad dhakhtarka u tagtaa ama dhakhtarka wacda aad u sheegtaa because waxaasayto waa sign ah in aad leedahay high blood pressure marmarka qaarkood waxaa dhacayso madax xanuunka markuu kaa bato indhaha waxaad ka arkaysaa waxyaalo ma arkino oo sida milmiliyo kale hore ku socda arkaysaa taas ayadana waxaa kamid ah signka oo ah dhiikarka marka dhakhtarkaaga waa inaad la socodsiisaa waa inaad wacdaa haddii aad waxyaalahana isku aragto I think I did it well. I could continue.
Okay, so I'm going to talk a little bit about important visits that you'll have during your second trimester. So we can start talking about the ultrasound too, because this was something that you had mentioned, Suad. So typically around 20 weeks is when there's typically in a pregnancy without a lot of medical complications, there's two big ultrasounds. The first is your dating ultrasound, which happens early when you see how old is the baby and when is the due date. And then the second big exciting one is the one in the second trimester that we call the anatomy scan. And that usually happens right around 20 weeks, usually between 20 and 22 weeks. That's a fun visit because you get to really see the baby and all of the organs and its heartbeat, and it starts to look like a little baby, like it does in that picture there. And like Dr. Posada was saying earlier, we look at some other things too on that scan. So we'll look at the fluid and make sure there's enough fluid around baby. We also look for the placenta. And so it's important for us to know where the placenta is. If the placenta is too close to the cervical opening, that could create some problems down the road for bleeding with delivery. And in that case, you would then have to have more ultrasounds to make sure that goes away. If you do say you are in the second trimester and you had an ultrasound that said your placenta is too close to the cervical opening, which is called a previa, don't think that's not the end of the world. They can resolve and sort of move further away. So it's just something we monitor more closely. And then we also, look at the size of baby and say, is this baby growing appropriately? Is it growing too much? And all of these factors are things that we decide whether or not we need to do more ultrasounds as you go on through the pregnancy. But that's a fun visit just to see how baby's looking. Another big visit, and Suad, do you want to interpret in between or do you want?
Yes, let me interpret on that.
Okay.
So balantanito in second trimester can also waxaa jirta balan oo important oo laga rabo inaad tagtid balantaas oo ultrasound balantaada. In ultrasound waxaa la check gareynayaa haddii horta ultrasound inta la check gareynin balan waxaa jirta aad dhakhtarka tagayso oo la fiirinayo haddaad qabto maxaa la dhahaa gestational diabetes. Gestational diabetes waxaa la dhahaa sokorta. Sa haddayd kasoo hadalnay waxaa jirta labo shay oo ku dhaca gabdhaha. Midna waa sokorta oo ku dhaca gabdhaha uurka qaba iyo midna waa dhiigkarka oo ku dhaca gabdhaha uurka qaba. Laakiin marka uurka aad dhasho labadaas way kaa tegayaan, labadaas laga fiirinayaa. Midka kaleeto waxa waaye anatomy scan markay ku dhahayaan waxa weeyaan in ultrasound la saaraya. Ultrasound waxay fiirinayaan ilmaha koritaankiisa iyo mandheerta ayay fiirinayaan macnaha koritaankeeda. Marmarka qaarkood waxaa laga yaabaa waxa la dhahaa placenta previa inuu dhaco. Macnaheedu waxaa laga wadaa mandheerta waxay kasoo hormaraysaa cunuga. Waxaa sayto haddaad isku aragto ha iswaalin, ha ismurjinin, dhaqaatiirtaada kula soconayaan. Waa wax la samayn kara weeye, laakiin macnaha ha iswalwalinin. Teeda kale generic screening wax la dhahaa jiro in dhaqaatiirta badanaa way sameeyaan. Ilmaha waxaa laga eegayaa. Are you going to talk a little bit about generic screening?
Yeah, I'm going to talk about everything else on this slide, but that was just my bit on ultrasound.
Okay, so generic screening waan ka hadlaynaa waxyaalaha ay ka wadaan iyo maxaa la dhahaa immunization that might be due ama talaalada oo macnaa marka uurka aad leedahay oo laga rabo. Talaalaha jirto oo laga rabo markaad uurka leedayd. Golden rule waxa weeyaan waxyaalaha laga rabo waqtigan aad ku jirtid. Eat little, waxyaalo badan inaa cuntid oo cunto laakiin waxa laga rabaa inaa cuntid oo maxay yiraahdaan caafimaad cunto caafimaad high protein macnaha hilib badan. High fat macnaha high fat marka lagu dhahayo ma ahan briisi basta badan isku xaqdid ma ahan. Low in carb macnaha waxyaalo adi wax oo nadiif oo maxay dhahaan caafimaad leh waa inaad cuntaa. Hal maalna nutrition aan ka hadlaynaa inshallah. Maybe one day we should talk about nutrition class because very hard to explain. Salata badan aa cunaysaa iyo vegetable badan, biyo badan aa cabaysaa, exercise waa samaynaysaa. Exercise marka lagu dhahayo ma laga hadlayo inaad gymka aadidoo isku soo qortid ama aad ma arkino wax samayso ma ahan. Xataa maalinta 20 daqiiqo inaad baxdo banaanka aad soo socoto, fresh air aad soo qaadato way kugu filan tahay markaad uurka leedahay. Go ahead.
Great. So I think you might have said some of the things that I'll talk about a little bit more, but gestational diabetes, that's something that happens during pregnancy, and it's it's a similar, but it's different than diabetes that someone would have when they're not pregnant. We're not very great. There are risk factors for developing gestational diabetes, including having diabetes, being overweight, which is why we talk about eating healthy and exercising. But sometimes it just happens in a pregnant body, and it's because of the hormones that the placenta is making that make your body not sort of metabolize your glucose very well. And so around 24 to 28 weeks, we have people drink a sugary drink that I've heard doesn't taste very good, and then check your blood sugar once an hour after that. And if the blood sugar is too high, then we repeat it where you drink it again, and then we check the blood sugar for 3 more hours. And the reason why this is important is because gestational diabetes can affect the baby, because it can make the baby grow too large. That can affect your ability to have a vaginal birth. And then it can also have the baby have low glucose levels after birth. And glucose is really important for brain development and body development and all of that. So it's just something that we as doctors want to be aware of. And if you do have gestational diabetes, then we'll have, depending on the level, we have people either check their sugars and sometimes need to be on treatment. And the nice thing about it is that if it is something that you're diagnosed with, it goes away after pregnancy. So once the baby has been born.
Gestational diabetes hadayt waa taa idinka sheekeynayay waa sokorta oo ku dhacda gabdhaha uurka leh laakiin way ka tegaysaa. Laakiin waxaa jirta inay fiiriyaan siday ku fiiriyaanna waxa weeye inaad qabto marka 20 week aad marayso 24 week inta u dhaxayso cisbitaalka lagu balminayaa hal maalin waxaa lagu dhahayaa cuntaha soo cunin markaas waxaa lagu siinayaa daabona ma ahane waa adi wax oo sonkor oo kale ku jirto waaye oo galaas lagu shubayo waad cabaysaa waxaa joogaysaa kliniga way fiirinayaan way eegayaan waxay eegayaan sokortaada inay kor u kacayso haddii sokortaada kor u kacdo waxay ku sheegayaan macnaa in aad sokor leedahay dhakhtarka markaas uu fiirinayo haddii sokortaada kor u kacdo haddii sokortaada hoos u degto ama haddii sokortaada normal tahay haddaa sokor qabtid oo kugu dhacdo maxaa la dhahaa pregnancy-ga intaad leedahay waa la daaweyn karaa wax la daaweyn kara way tahay qaarkood waxaa dhacayso inay qaataan insulin wax la dhaho oo sokortooda hoos soo dejiso qaarna maba u baahnaba insulin inay qaataan cuntada ay cunayaan kaliya ay eegayaan ay controlayaan the reason ka loo fiirinayo gabdhaha inay qabaan maxaa la dhahaa diabetes maxaa la dhahaa sokorta inay qabaan waxa weeye hadhow cunuga kugu weynaanayo cunug hadduu kugu weynaado markaa fulanaysid dhibaato baa cunugaas inuu banaanka soo baxo. And what is the other thing that they look for in gestational diabetes besides babies getting big about the mom?
After birth, it can make the baby's sugar actually go too low after birth. And so then we need to give them more sugar.
Yeah. And markuu ilmaha ay dhashtaane habraha oo maxay yiraahdaan qabo sokorta cunuga markuu dhashto waxaa laga arkaa ama lagu arkaa in sokortiisa hoos u dhacdo marka waxay siiyaan biyo oo sokor ah si sokortiisa kor loogu soo qaado. So we're good.
Great, cool. And so then the other topic that you have on the slide here is genetic screening. And genetic screening is a topic that it can be a very personal topic. And I think it's something that can be discussed at any time in pregnancy. And oftentimes will be discussed with your doctor earlier on in the first trimester to sort of understand what you're leaning towards. And also because there are tests that span both the first and second trimester. So there are some tests that you can get as early as 10 weeks, and then some that are more in the second trimester. I think, without going into too much detail on it, the way that I counsel patients when I talk to them about genetic screening is I say there's sort of 4 different types of things that we can do. And these include things that include blood tests and ultrasounds, and then 2 that are a little bit more invasive, which involve testing the blood from the placenta, and then sticking a needle into the belly and testing the blood, the fluid around the baby. And then the other thing is that there's sort of three camps of people, and the way I break them down is that there's people who don't want to know anything because it doesn't matter and they wouldn't do anything about it. The second are patients who want to do the testing because they want to know if there could be some genetic condition, but they're still not going to do anything about it. And then the third are people that want to know because this might make them want to terminate or not continue the pregnancy. And so that's sort of how I approach it. And then I think one thing to say too with the amniocentesis and the chorionic villus sampling, those are the two more invasive methods that we use for screening. I think there's a lot of worry around those because people hear about them and come with this risk of miscarriage. And that certainly is a risk. Other risks are just cramping and bleeding and infection. But those risks are pretty low, and the risk of miscarriage from either of those methods is actually less than 1%. So it's a conversation that you can have with your doctor and to decide that if that feels like something that's right for you, the risk of miscarriage is actually really, really low in reality.
And genetic screening, waxaa la dhahaa gabadha markay uurka leedahay, and this happened during 20 weeks or 24 weeks?
It depends. It depends on what you're doing.
Okay.
It can span between 10 to 24 weeks.
wuxuu dhacayaa 10 week ilaa iyo 24 week dhexdoodu dhacayaa haddii habarta codsato haddii rabto haddii codsato waa laga qaadayaa. Waxay sameynayaan cirbad waxaa jirtaa dheer ah oo lagu mudayo habarta caloosheeda buufka actually bay ku aadan tahay. Cirbadaasayto waxay kasoo qaadaysaa dhiig waxay kasoo qaadaysaa mandheerta placenta la dhahaa mandheerta kasoo qaadaysaa. Dhiigaasayto wuxuu sheegayaa ilmaha hadday macnaha ay qabaan jirooyinka oo macnaha ilmaha qabo kaleete. Hadday qabaan habraha qaarkood way rabaan inay ogaadaan, habraha qaarkoodna ma rabaan inay ogaadaan. Sidii kuwan gaaladoo kaleete way jecel yihiin inay ogaadaan because hadday ogaadaan qaarkood waxay dhahaan ilmaha laga soo tuuro, aniga muslimiinaan ahay waxaas ma samayno. Maxaa la dhahaa mana amino inaan isku samayno, mana arkin gabdho badan oo gabdho samaynaya waxaasayta maanan arkin. Laakiin genetic screening waxaasaa la dhahaa la socda iska ogaada. Haddii lacala aan la warsado micnaheeda waxaasaa laga wadaa waa in kasoo qaadaan dheecaan dhiig isku laban cunuga mandheerta ay kasoo qaadayaan si ay u ogaadaan cunugaasayto waxyaalaha cudur ah oo cunuga qabo. Go ahead.
Okay, and then the very last thing I'll say on this topic is that we talk about immunizations, and this can also be a sensitive subject in pregnancy. Some people don't feel comfortable getting immunizations during pregnancy, but we do it to protect you and to protect baby and to protect people that are going to be around baby. And one thing right now that is new is that we as doctors are recommending the COVID vaccine for everybody that's pregnant. And so that might be something you talk about with your doctor, as well as getting things like the flu vaccine and usually a tetanus vaccine around this time.
Yeah, this is my favorite, by the way. Is there some detail on the immunization, like whooping cough, and which other ones you guys wanted to add it on?
I didn't say in this slide, but yeah, so the tetanus vaccine is the whooping cough vaccine. And so that's one that we recommend, but you can also get that this is another thing that can span, all of these things can also span into the third trimester. And then the one that I also didn't mention is the ROGAM, and that has to do with your blood type. So that we would do around 28 weeks if you need it.
And waxaa dhacayso second trimester ilaa trimesterka saddexaad inta u dhexayso inay habarta laga qaado la siiyo talaalo badan. Talaaladaas oo kale ah mid waxaa jirta la dhahay whooping cough oo mar hore soo baxday oo habarta la siiyo. Necessary maahan inay qaadato, laakiin waa recommendation dhaqaatiirtu way recommend gareeyaan. Iyo maxaa la dhahaa mid kaleeto oo tetana ah, taas recommendation way taas qasab ah habarta inay qaadato, waa tetanaheeda inay qaadato. Iyo mid kale rogaine la dhahayo oo blood type ah, macnaha qabra qaarkood waxaa jiraan oo dhiigooda aan iyo dhiig cunuga isgalaynin. Taas dhaqaatiiradaada maxaa la dhahaa faahfaahin kugu siinayso haddaad u baahato le, laakiin immunization macnaha talaaladaas jiro oo macnaha habarta loo offer gareynayo oo loo sheegayo inay qaadanayso ama oo loo baahan yahay inay qaadato la rabo. Marka dhaqtaradaada kula socodsiinayso talaaladaas inay jiraan hadeertaan lagula socodsiinaya. Go ahead.
There you go. I didn't unmute myself. So these are some other things. We've talked about a lot of things to think about during the second trimester, but these are a few last important points. One thing we didn't mention, but maybe was mentioned during the presentation on first trimester of pregnancy, is that oftentimes people have a lot of nausea during that first trimester, or what we call morning sickness. And for not all pregnant people, but many pregnant people, that can sort of resolve or get better during the second trimester. So you might start to feel better, which is really nice. Hope and if not, there are other medications that we can give you to help with that, and they're the same ones that we probably would be giving you during the first trimester. So in that regard, because you're feeling better, this is a really good time to start thinking about what things you need to do to start preparing. So we've talked about how your body is starting to show that you're pregnant and your belly is growing. You may need some new clothes. Your current clothes may not fit as well. So some good tips are just to ask for, if you have friends who've been pregnant previously, or consignment stores, that oftentimes you can get pretty good things for less money, especially because you won't be needing these clothes beyond your pregnancy. So I don't think most people don't want to invest much money in clothes that they're only going to be wearing for a very short period of time. This is also a time when some people start to enroll in birthing classes. You may already be connected to a doula or some sort of birthing support person. But if not, this is another good time to start to take advantage of that kind of support and think about who you might want there with you when you're delivering. And conversely, if you have children already, who might be caring for your children in the event that you go into delivery. And it is pretty far in advance of when you likely will be delivering, but good to start planting the seeds and getting some plans in place. One piece that I think is a good recommendation that's not on the slide is it's also a good time to start thinking about if you want to enroll in any breastfeeding classes or infant CPR classes. And those, you can find resources in the community for those. You can also ask your doctor or your doula if they have specific recommendations, or folks that they like to send their patients to. In that same vein, mom discussion groups can be really helpful, just because there are so many questions and so many changes going on. It can be really helpful just to have some other people who are in your same shoes at a similar point in their pregnancy to reassure you or get ideas for things that they've done or places they've gone for any of the classes that I mentioned already. And so you could ask your doctor or your midwife if they offer centering pregnancy, which maybe if they do, they probably have already talked to you about it. And that's one type of program that some patients find really helpful, just in terms of being connected to other pregnant people who are around their same gestational age. But if you're involved in any sort of community center, sometimes they have new parent groups that can be really helpful for people.
waqtigaan markaa ku jirtid waxaa laga rabaa in aad kasii fikirto horta korkaaga wuu isbedelaya, waad ogtahay. Dharka wuu kugu yaraanayaa, dhar kaleet waa inaad raadsataa oo macnaa ku anfaco. Waxaad warsan kartaa saaxiibadaada haddii oo ku siinayaan dharka ayaga oo ka weynaaday, because dharka hadduu kaa weynaado waxaa laga yaabaa in markaa dhasho haddana aad kusoo noqoto sidii aad ahaan jirtay oo kaleete. Ama dhar adiga kaa waaweyn inaad soo gadato oo holof ah, macnaa siduu kuu anfaco, because dharkii horeeto kuma anfacayo, calooshaada way soo weynaatay. Also inaad qaadato galaasyo loogu talagalay habraha oo uurka leh oo ka faa'iidaysanayo dhalitaanka iyo waxaasiito. Soomaalideen badanaa waa jiraan galaasyadaasiito, laakiin way imaadaan been ma isku sheegayo. Haddaad rabtaan inaad imaataan way fiicnaan lahayd, inaad ka faa'iidaysataan aad u fiicnaan lahayd. Ama inaad la xiriirto duulahaaga. Gabdho badan oo Soomaaliya duula magaalada degan, ani ku jiro nafsadeyda, inaad la xiriirtaan, macnaa caawinaad warsataan oo kala hadashaan macnaa qofkii ku raaci lahaa markaa dhalaysid ama ku siin lahaa support markaad dhalayso. Also haddaa caruur aad leedahay macnaha caruurtaada qofka aad u geyn lahayd markaad dhalayso si aadan u ordin markay foosho ku qabato aad weysid qof caruurta kuu fiirinayso oo kaleete waa inaad kasii fikirtaa qofkii aad u geyn lahayd ama child care ama day care aad macnaha sii haysataa ay ku leeyihiin ama gabar saaxiiba tihiin ama jaar ama diris aad tihiin inaad ilmahaaga aad usii sheegto dhahda hebel miyaha ama heblaayo miyaha hadhow marka ani aan dhalayo waxaan jeclaan lahaa inaa caruurteeda aad isii fiirisid ama haddii emergency macnaha ay qabtaan ama fool habeenimo ay qabato inaa caruurta aan lagu keeno haddii adi family inta aadan ku lahayn ama baby sitter aad lahaato. Marmarka qaarkood waxaa jirtaa community centerada badan waxay leeyihiin mommies group hooyooyinka groupyaha jirtaan oo hooyooyinka isku imaado oo ka wada hadlaan dhalitaanka iyo waxyaalaha lamid ah iyo ilmaha korintooda iyo just hooyo sida hadda mommies corner oo kale hadirtaan meesha ay imaadeen oo kaleeto maxaa la dhahaa sabti walba halkaan isugu imaanaan ka hadalnaa waxyaalaha ku saabsan uurka hooyanimada iyo korista iyo familka iyo waxa ku saabsan maxay dhahaan qoyska. So saasay hadda ka hadlayaan. Go ahead. We're doing good on time. Yeah.
Yeah, and I mean, I think that's really all the information that we had, actually. These are just some really good resources that we wanted to share. So whattoexpect.com has really nice like pages about different phases of pregnancy. If you're ever curious about what to expect as you progress throughout a pregnancy, familydoctor.org here is just sort of summarizes some of the changes in your body that we talked about today. And then like Dr. Thayer was kind of mentioning, we do definitely recommend getting the COVID vaccine during pregnancy. And so this is the CDC website here that has some information about specifically the safety of the COVID vaccine for pregnant people. And we'll send, so if it's helpful to send this out, we can send these slides to you. So
and I'll share it, and because we have a WhatsApp page, so I can just put it over there.
Cool. Yeah. And I think, yeah, that was all the slides. So I think, Swat, if you want to like just interpret that last bit, and then we can open it up to any questions that there are.
Finally, and marka waa noo dhamaaday slides-keena presentation-keena wuu dhamaaday waxaanayto waa hadda waxay kasoo wada hadlayeen in siiyeen information-ka haddaad u baahataan ana iisoo dirayaan whattoexpect.com haddaad u baahataan website-kaas aad galaysiin information-kii hadda inta noogu bixiyeen oo dhan meeshuu ku jiraa haddii kaleetana ana ila soo xiriiri ana idin soo dirayo haddii kaleetana maxaa la dhahaa WhatsApp page-keena hadduu soo dhigaya insha Allah. And yeah, su'aalaha haddaa qabtaan hadirtaan waan furaynaa maxaa la dhahaa goobta dadkiina kaleeto Facebook ku jirane su'aal haddaa qabtaan ku qora meesha waa idin soo check in garaynaya waa ka jawaabaynaa su'aalihiina. We're good.
Su'aaday gabadha xaamilada ma qaadan kartaa vaksiinada? Weydii su'aasha.
Gabadha xaamilada ma qaadan kartaa maxay tilmaantu?
Talaalkan vaksiinada.
Oh, the vaccine? Okay. So can pregnant mom take the vaccine? We can close this so I can just pull you guys up.
Is it the COVID vaccine specifically? Is that the question?
Yeah, the COVID vaccine.
Yes, we recommend that people get the COVID vaccine. It is safe in pregnancy. And if you do contract COVID while you are pregnant, you are at risk of becoming severely ill, which is why we recommend it.
The other
COVID vaccine habarta uurka leh aadan u recommend Grace aad baan rabnaa inaan macnaa ugu faala bixinayo ku tirahday in ay habarta uurka leh inay qaadato COVID vaccine-ka important way.
And then there's also evidence that the vaccine can help pass immunity to baby.
Also vaccine-ka haddaad qaadato markaad uurka leedahay waxay usii gudbinaysaa cunugaaga protect garaynaysaa amiinkiisa ama amiinka cunugay protect garaynaysaa.
Su'aaday abaya ana laba su'aalood rabo inaan weydiiyo dhaqaatiir.
I have two questions.
Abaya aniga cunugii labaadan hadda waxaan ahay 32 week marka cunugii koobaad 8 bilood ku dhashay biyaha iga dilaaceen. Marka cabsi waxay igu jirtaa marka cunugan kalan inuu early dhasho because waxaan dareemayaa maarta nabar camal oo iga qabanayo gumeerka oo la shalay maanta isku arkaayo marka maxaa sababi kara ku dhay ilmaha inay saas oo kale ay biyaha early u dilaacaan.
This is my second pregnancy. I am 22 weeks today, right now. My first pregnancy, I broke my water early as 8 months. 8 months is how many weeks?
About 36.
About 36, yeah. So she's afraid that it would happen again. And she's been having a lot of abdominal pain lately. She's asking what she would do.
You know, I think I would definitely talk to your doctor about the abdominal pain. I think, so like we were saying earlier, some of that abdominal pain probably could be caused to the round ligament pain, which is the stretching of that part of your uterus that's attaching it in place. But your doctor would want to know if you were having abdominal pain so that they can look to see if there are any reasons that you might be having signs of preterm labor. It also could be, we didn't talk much about Braxton Hicks contractions because 32 weeks, you're really in your third trimester now, but Braxton Hicks contractions can also be a normal part of the later stages of pregnancy, which are kind of like false contractions. So it's some like spasms of your uterine muscles that aren't actually like a true labor pattern. But I would recommend talking to your doctor about the pain, and congratulations on your pregnancy.
أنا waxay ku tiraahday horta xanuunkan haddartaan wuu dhaca oo waqtiga hadda ku jirto laakiin ma ahan xanuun oo laga yaabo inay tahay hadda waxaa laga yaabaa inay tahay Braxton Hicks micnaheedu waxaa laga wadaa fall oo laakiin run aanan ahayn laakiin fooshii beenbeenta ahayd ay tahay inay tahay ayaa laga yaabaa haddartaan inay bilaabato because hadda waxaa ku jirtaa 32 week soo maahan adi
haa waxaan ku jiraa 32 week
32 week laakiin xanuunka oo macnaa oo ku hayo oo macnaa oo ka hayo hoos dhakhtaradaada si fiican ula hadalay ku leedahay maadaama oo hadda ka hor oo macnaa 8 bilood ka hor cunugii kaleeto macnaa biyahaaga ay dilaaceen waqti oo macnaa oo hore laakiin
waxyaabo waxaad tiraahdaa sababi kale ma jiraan oo macnaa hooyada loo baahan yahay inay iska ilaaliso biyaha inay dhaqso kasoo dilaacaan.
Is there something preventable that I should do in order for me not to break my water early as I did my first baby?
I don't know if either, oh wait, I think you're talking, I don't know if either of you, Dr. Poseda, Dr. Clintock, have any specific suggestions. As far as I know, I don't know if there's anything specific not to break your water. It is unfortunately something that just happens for some people. And if it's, after 36 weeks, that's okay. And, we just manage you accordingly if you come to the hospital. What I will say is if your water does break at any age, you go be seen at the hospital. One thing though that you can do to prevent contractions that is simple that anybody can do at home is keep yourself hydrated. So oftentimes dehydration as well as some other things can cause contractions. And so if you keep yourself nice and hydrated and drink lots and lots of fluids, that will prevent your uterus from contracting, which could potentially contribute to your water breaking. So that would be my best advice.
Yeah. macnaha waxay ku tiraahdaa horta aniga ma ka celin karno biyaha dilaacitaankooda laakiin foosh horta waxaa keenaysa mogtahay ilma galeenka oo macnaha oo dhaqdhaqaaq bilaabayo marka waxay ku tiraahdaa ilma galeenka dhaqdhaqaaqiisa waxaa celin karo haddii korkaaga oo biyo badan aysan ku jirin markaasayto dhaqdhaqaaq wuu bilaabaya dhaqdhaqaaqana waxaa keenayso fooshana maxay usii soconaysaa biyihii inay dilaacaan marka saas daraaddeed waxaan kula talin lahaa always inay korkaaga biyo ay ku jiraan inaad macnaa biyo badan cabto si ay ilmagaleenkaaga uusan dhaqdhaqaaqa u biloowin dhaqdhaqaaqa markuu bilaabana ay foosha aysan ku aadin.
And just like Dr. Poseda said, very important to talk to your doctor about it because sometimes the abdominal pain you're having could be a sign of an infection, like a urinary tract infection or a yeast infection. And those are other things that can also cause preterm labor that are easily treatable. So it's best to just investigate and see what's going on.
marmarka qaarkood waxay ku tiraahdaa xanuunka hoos aad ka dareemaysid waxaa laga yaabaa inay tahay kaadida infectionkeeda inuu ku hayo marka ama yeast infection markino gabdhaha waxaa ku dhaco infection host oo laga helaa jirto taasna waxay samaysaa in ay ku rido habrata in a preterm labor معناها fall degdeg inay kugu keento marka intaysan kugu dhicin ka hor dhakhtarka la tag because kuwaasayt waa la daaweyn karaa daaweynaa jirto habarta la siiya ay qaadanayso oo safe cunugii ayadaba u ah oo ka hortegi karto adigoo aanan aadin in maxaa la dhahaa in fall aysan ku qabanin oo sugi kartid waqtigaaga ilaa ka dhamaysanaysid
haya baa aada u mahadsantihiin dhaqaatiirtana u mahadsanyihiin
thank you so much guys. Any more questions? Oh, let me check my Facebook. What up? What up? Wait. Okay. Whoa. That's not my Facebook. I'm so terrible, you guys. Where are we? Okay. I don't even know. While I'm checking my Facebook, do any of you have any questions, you guys? Hello? Because it's 6 after 6.
Doctors, hi. I just have a quick question about the two tests for genetic testing. What was the, aside from the amniocentesis, what was the other one?
So chorionic villus sampling is, I think, the one that you might be talking about that Dr. Thayer mentioned. So it's the abbreviation is CVS, and in addition to amniocentesis, those are the two invasive tests, which mean we're actually taking a sample directly from like baby's cells. And that one is done earlier. So that one, the CVS is usually done, I think it's between 11 and 13 weeks. But amniocentesis can be done anytime.
And thank you. How is the other one done? Is it also through a needle draw?
Yes. Yeah. Both involve like a needle going kind of through your abdomen and getting a direct sample of the fluid around baby cells, or in CVS, I believe it's actually like a sample of the placenta. And because they're invasive like that, they are the ones that are considered to be the most accurate or the most sensitive. But the other genetic tests are also give you a lot of really great information.
And is the like the option only to terminate the pregnancy if something, like if there are abnormalities found, or is there something, something else that can be done while in utero?
Like if it's a genetic abnormality that's been found, there's not much that can be done to change the genetics, but the option, there's never any, you never have to terminate a pregnancy. At that point, it would be a conversation about what the genetic abnormality is. And sometimes it could be something that's what, that is severe enough where the baby may not be able even to survive to delivery, or it may be something that's so severe that the doctors may say that baby might not survive for very long out of the womb, or it could be something that's much more mild. And so there's a huge amount of variation in terms of what a genetic abnormality can mean. And we all have different like small genetic abnormalities that we likely never know about because they don't impact us. And so it is something that you should definitely be having in terms of like a conversation with your doctor, because it's a very personal decision, not only in terms of like what the abnormality might be, but also in terms of like what your values and desires are, and where you are in your own life journey.
Thank you.
All right. I think we're doing so good. Anybody else? Last question. Who wants to take it? So next time we are going to talk about the third trimester, right?
That sounds good to us.
All right. Third trimester. I'm writing down right here. We're getting close.
And then I heard you say that maybe like a nutrition in pregnancy sounds like an interesting topic.
Maybe we should put like a nutrition in pregnancy in the middle and then the third trimester. What do you think?
Whatever works for you guys, or just we just want to, do things that you guys think are actually interesting and have questions about.
I would say nutrition in pregnancy next time.
Okay. Yeah, we can see what we can put together.
I wonder also, I mean, the third I don't know how much.
Third trimester is, maybe you can combine.
Maybe we can combine them and do like a talk on sort of like nutrition and like healthy habits in pregnancy and combine that with the third trimester. What do you guys think?
Yeah,
it's up to you guys. Nutrition in pregnancy and healthy habit, or should we say healthy habit pregnancy?
Yeah,
healthy habit pregnancy. I like that. That's really actually good. Well, I thank you so much, ladies, for coming out this wonderful afternoon. And I appreciate you guys as always. And I can't wait to see some of you again next month. Have a wonderful holiday. Enjoy your time. And I don't think I'm going to see you until after the new year.
yeah.
That's so exciting. Oh my gosh. Yeah. Happy New Year, everyone. And thanks so much for
2022.
Wild.
Crazy.
It's a wild, crazy year. Oh my goodness. Oh my goodness. I can't believe this is happening. Yeah, it's happening.
What a great turnout too. There were so many people logged on. I'm so
it's a great turnout today. Yes. Yes.
Awesome.
Yep.
The rain was in our favor.
Yeah.
Definitely. Yes. Yes. The doctors are in. Every time you guys are in, I have a great turnouts.
Oh. Well, thanks so much for having us. We really enjoy it.
No, the pleasure is mine. Oh my God. Oh my goodness. You guys are amazing. Thank you very much. Enjoy your evening, what's left.
Yeah, you all too.
Thanks, everyone. Thank you, Suad.
Bye.
Bye.
السلام عليكم قبدو.
وعليكم السلام سعادة يا باي واكم mahadsantahay waqtigaaga.
Thank you so much, Abai Safiyo. Thank you, Saido. Thank you, guys. Thank you very much. Next week, as arkayna, inshallah, we're going to have another topic. Waxaanu imaanayso gabar oo ka hadlayso ilmaha muslimiinta sidii loo korin lahaa iyo familka muslimiinta, inshallah. It's a very good topic, guys. Please come.
Inshallah. See you tomorrow.
Yes, I'll see you tomorrow, Saida iyo Safiya. Both of you guys.
يا حبيبتي.
Hi, حبيبتي. Salam alaikum.